surgery plan has been incredibly impactful for us. So we put it in 2022, and we chose to do the mandatory approach for spine, joint, and bariatric, which was a little aggressive for us, but we felt it was the right thing to do based on financial savings opportunities. And also we felt that it was a win-win because we weren't taking anything away from the colleagues. We were giving them the opportunity to ensure they got high-quality surgeons that would take care of them. We did our own analysis and compared it to our per surgery cost, per episode cost prior to putting in Lantern. And we confirmed we've definitely seen significant savings from the program. And we know our colleagues and their families are getting high quality care. We know they're going to the best surgeons, and we feel very confident that we've provided a great program for them. We decided to add the infusion program to our portfolio of offerings. We saw we had a need. We saw that our costs were going up, and infusions was a big part of that. So we were looking, one, for an opportunity for financial savings, but also to give our colleagues an opportunity to make sure that they were getting the appropriate care at the right place. The infusion program gave us an opportunity to take those infusion medications out of the hospital settings, out of the provider settings where they're marking up the cost of those infusion medications, but also give our colleagues an opportunity to have it done more locally or even at their homes. So it allowed us, again, to have a win-win of not only the savings for the plan, but also a better experience for participants. We were inspired to add the cancer care program because we saw an increasing incidence of cancer in our population, right? Just like probably every other employer out there. And so we felt like we had to do something. One, for our colleagues who were facing what can be a devastating diagnosis, and wanting to make sure that they were getting the care they need. But two, because we also saw our costs going up because of all the cancer diagnoses in our population. So we were looking for a solution that could help us on both ends of that equation. Lantern's program did just that. So it provided us with the nurse oncologist that were able to provide our colleagues with the care that they needed, getting their questions answered, holding their hand through the diagnosis and the treatment, making them feel like their employer cared about their health and their well-being. And then on the financial side, through the partnership that Lantern has with Access Hope, we were able to get them access to NCI level oncologist specialists who, working with their local oncologists, were able to ensure that they were getting the right diagnosis, the right treatment, and hopefully in turn ensuring that we were managing our cost appropriately. Our experience has been phenomenal. We've had quite a few of our high-risk, very unique cancer cases evaluated by some of these specialists around the country that have been able to impact our colleagues locally. And we've heard a lot of anecdotal stories from our colleagues that have just raved about the care that they've gotten from the care advocates. And knowing that there's someone there that they can call with any questions they have, or knowing that they have someone that's going to reach out to them proactively to make sure they're okay, they've really appreciated that. A heartfelt thank you to all of our care advocates that help our Hyatt colleagues every day. Here at Hyatt, we believe in the purpose of care so that people can be their best.